deep plane neck lift. I want to explain what this procedure is, who's a good candidate, and what to expect for how the surgery is done to get optimal results that last essentially forever. So deep plane neck lift, what does that term mean? Deep plane, the term deep plane comes from the fact that we're lifting and shaping the muscle and the fascia layer. Fascia is a fancy term for very, very strong, thin layer of tissue that connects a deeper muscle layer to the overlying skin. So for example, in the neck area, the deep plane or the muscle fascia layer is called the platysma muscle. It's this thin sheet of muscle that wraps all the way around the neck, going from the jawbone down to the collarbone, and I can activate it by making a weird grin like this. You can see these bands pop out. And those platysma bands make up the platysma muscle, and that is the deep plane. Deep referring to under the surface, below the skin layer, and plane just means layer. So the muscle fascia layer is actually the key to getting a sculpted, beautiful neckline and jawline. And of course, aesthetically, that's what we're all striving for. As we age, we tend to see that there's heaviness of the jawline, particularly in the jowl region, heaviness in the neck. And that platysma muscle acts like a hammock. So if you think of this analogy of a hammock suspended by two palm trees, that hammock over time starts to loosen up, and we get an appearance of a more aged neck with loss of jawline contour and definition and fullness in the neck. Now, deep plane neck lifting refers to tightening the platysma muscle. So I do that through 3 incisions. Number 1, right under the chin, that gives me access to the central neck area. I basically separate the skin away from the underlying platysma and fascia layer. And number 2, behind the left ear. Number 3, behind the right ear. Now, oftentimes I will have to bring the incision line in front of the ear in order to re-drape excess skin so that there's no bunching of skin here. So deep plane neck lift, typically I'm blending that with a deep plane lower facelift to get a really clean, beautiful contour of the jawline and neckline, and oftentimes that involves some re-draping of skin. But if we're focused on lifting the deep plane or the platysma muscle, then we can really shape the jawline and neckline, not worry so much about the scars because it's the muscle fascia layer that holds the tension. It's really a critical component of a proper deep plane neck lift. It really is the gold standard in neck lift and facelift, and if it's done well, we can get results that last 15, 20 years. Of course, we continue to age, but we can get essentially permanent results when we're addressing that deep foundation layer of the face, as opposed to just trying to pull on the skin, which is not a good idea. Now, in terms of recovery is fairly straightforward. It's an outpatient surgery. I do the surgery in a hospital-based surgery center for safety, where we have board-certified anesthesia teams, a lot of expertise under one roof, and George Washington Hospital, Sibley Hospital. These are the top-notch hospitals in this area. Recovery is outpatient, so you don't have to stay overnight. You can recover under the care of a private nurse. And then over the course of the first few days, there's some tightness feeling, but that rapidly goes down. The pain is very minimal, and within about 1 to 2 weeks, patients can start looking normal again with that swelling going down. Overall, it's a very reasonable recovery where after about 2 weeks or so, you're looking and feeling pretty much back to yourself.